Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome to today's episode. Today, we're diving into a topic that continues to impact communities worldwide, the opioid crisis and the evolving landscape of public health interventions. I know I'm starting to sound like a broken record, but this is a really important health concern, and I can't stress how important it is for us to learn as much as possible. So let me just jump right in. In the late 1990s, there was a sharp rise in opioid prescriptions for pain management. What started as well-informed effort to treat pain led to widespread addiction. In the first study we'll be discussing, Colondi and his colleagues describe how addicted individuals facing tighter prescription controls turn to heroin, a cheaper and more accessible substitute. The article argues for a comprehensive public health approach to tackle the opioid crisis. This means going beyond law enforcement to focus on prevention, treatment, harm reduction, and policy reform. Let's break down these strategies. Prevention. Educating healthcare providers on responsible opioid prescribing and promoting safer guidelines. Treatment. Expanding access to evidence-based treatments like methadone and buprenorphine, coupled with behavioral therapies. Harm reduction. Supporting initiatives like naloxone distribution to reverse overdoses and syringe exchange programs to prevent infections. Policy. Advocating for regulatory changes to control prescriptions and improve monitoring programs. Public awareness. Addressing stigma, raising awareness about addiction risk, and fostering community support for recovery. The article emphasizes that the opioid crisis isn't just a health issue. It's a societal challenge demanding collective action. By embracing a public health perspective, we can save lives, reduce stigma, and empower communities. In a second recent study published in JAMA Network Open, researchers examined how public health interventions are shaping outcomes for individuals with opioid use disorder. These interventions include medication-assisted treatment, MAT, naloxone distribution programs, syringe services programs, SSPs, and education initiatives. The study highlights that MAT, which uses medications like methadone and buprenorphine, consistently reduce overdose-related outcomes. These treatments not only manage cravings and withdrawal, but with lower mortality rates and emergency room visits due to overdoses. Naloxone distribution programs can play a role making this life-saving opioid antagonist readily available. When administered promptly, naloxone can reverse opioid overdoses, potentially saving lives in critical situations. In fact, in some places, doctors will provide individuals with naloxone if they prescribe them certain medications, such as hydromorphone, also known by its brand name, Dilaudid. Meanwhile, syringe services programs, SSPs, provide sterile supplies to prevent infections among injecting drug users. We covered syringe programs in a prior episode. While they contribute to public health by reducing disease transmission, their direct impact on overdose rates varies and requires ongoing evaluation. Education and outreach initiatives are pivotal in raising awareness about opioid risks, safe use practices, and available treatment options. By reducing stigma and increasing knowledge, these efforts encourage individuals to seek help and support recovery. These findings underscore the importance of a comprehensive public health approach to tackling the opioid crisis. Integrating effective interventions like MAT, naloxone distribution, SSPs, and education into policy and practice can significantly improve outcomes for those affected by opioid use disorder. In the third article, published in the Journal of Epidemiological Community Health, Dr. Kerr outlines the severity of the opioid crisis gripping North America. He underscores the need for urgent and effective public health strategies to combat this escalating epidemic. Dr. Kerr highlights several key approaches that have been pivotal in the response. These probably will sound familiar. 1. Harm reduction initiatives. These include supervised injection facilities, naloxone distribution programs, and syringe exchange services. These efforts aim to reduce overdose deaths and prevent the spread of infectious diseases among people who use opioids. 2. Expansion of treatment services. There's a critical emphasis on expanding access to evidence-based treatments, like medication-assisted treatment, such as methadone and buprenorphine. These treatments help manage opioid cravings and withdrawal symptoms effectively. 3. Policy and legislative changes. Kerr discusses the importance of policy reforms, including stricter regulation of opioid prescribing practices and enhancements to prescription drug monitoring programs. These measures are critical in curbing opioid misuse and diversion. 4. Public awareness and education. I know, I've said it before. The article stresses the significance of education campaigns to raise public awareness about the risk of opioid use and addiction. By reducing stigma and promoting safe use practices, communities can better support those affected. Overall, Dr. Kerr advocates for, I know you've heard this one before too, a comprehensive, evidence-based approach to addressing the opioid crisis. This includes integrating harm reduction strategies, expanding treatment options, enacting policy reforms, and empowering communities through education. Let me just pause here for a second and say, I know if you've been listening to this season or the last season or any season in this podcast series, you have heard this a million times. Do not think that I think you haven't figured it out yet, but it is really, really important that the comprehensive approach is really the only approach that we're going to find actually works. So, I move on. Lastly, in their article published in Public Health Reports, Solaner and colleagues highlight the severity of the opioid crisis and propose, here we go, a comprehensive public health strategy to combat it. This crisis has devastated communities across the United States, affecting individuals and families from all walks of life. The authors also outline several key components of their proposed strategy. These include prevention, treatment, harm reduction, policy interventions, and one that kind of is the same but a little different called integration of services. Here, they ask for ensuring coordinated care across healthcare, public health, and social service sectors. They claim that this holistic approach addresses the complex needs of individuals with opioid use disorder, including mental health support and social services. They also focus on addressing the social determinants of health. They want you to recognize and address social factors, such as poverty, homelessness, and lack of healthcare access that contribute to opioid use disorder. Solaner and colleagues stress the importance of collaboration among healthcare providers, policymakers, community organizations, and affected individuals. They argue that sustained commitment and resources are essential to implementing and maintaining these comprehensive strategies effectively. What I want to note here is not that I keep repeating myself, but that the way that I am repeating myself argues that no one thing is going to solve this problem. All of the parts have to work in conjunction together because all of the parts created the epidemic. So as we wrap up today's discussion, it's clear that the opioid crisis is a complex issue and it demands a multifaceted response. What began as a well-intentioned effort to manage pain has evolved into widespread epidemic of addiction and overdose deaths. The articles we explored today all emphasize the critical importance of a comprehensive public health approach. From prevention and treatment to harm reduction and policy reform, each strategy plays a crucial role in addressing different aspects of the crisis. Firstly, prevention efforts focusing on educating healthcare providers and promoting safer opioid prescribing practices is essential to reducing the risk of addiction from the outset. Second, expanding access to evidence-based treatments, not just any treatment in substance use programs, but evidence-based treatments like methadone and buprenorphine, coupled with behavioral therapies, offers hope for those already struggling with opioid use disorder. These treatments not only manage withdrawal symptoms, but also significantly reduce mortality rates associated with overdose. Harm reduction initiatives such as naloxone distribution and syringe exchange programs provide immediate life-saving interventions to help prevent the spread of infections among injecting drug users. Policy reforms are equally crucial, aiming to regulate opioid prescribing practices more strictly and enhance monitoring programs to curb misuse and diversion. Last, public awareness campaigns and community support initiatives play a vital role in reducing stigma, raising awareness about addiction risk, and fostering environments supportive of recovery. We can't do this if the public doesn't understand what we're doing. It is important that they understand addiction as a disease, and that they understand all the causes that brought us here. Only then will they begin to understand what the possible solutions entail. The articles we discussed underscore the importance of collaboration across healthcare, public health, and social service sectors. By integrating these efforts and addressing social determinants of health, we can make significant strides in mitigating the devastating impact of the opioid crisis on individuals, families, and communities. Remember, addressing the opioid crisis isn't just about treating addiction. It's about creating supportive environments where individuals can thrive. Together, through a unified public health approach, we can save lives, reduce stigma, and empower communities. I'll leave you with this thought. Take some time to consider how you can contribute, whether it's spreading awareness, supporting harm reduction efforts, or advocating for policy change. Every action counts in combating this crisis. What action will you take? Thank you for listening to the ACE-IT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of ACE-IT.